Welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzo.
In today's episode, we're going to be talking about post-operative total hip replacement once you leave the hospital.
Yeah, I get this question a lot. Where do I go after surgery? Can I go home? Do I have to have a special hospital bed at home? Or do I need someone to take care of me? So we're going to try and cover some of that stuff today.
So starting with that, Paul, what do you usually tell people? Where are they going to go once they leave the hospital?
Okay, so you've had your hip replacement. You've been in hospital for 2 or 3 days. It's time to go home. Where do you go? The main options are 1, home, 2, to a family member's house or someone who can help you, 3, a convalescent care center, so a place where you can go where there's some supportive care, or a rehab center. And these rehab centers can be in your hospital or they can be a separate building altogether.
Yeah, I agree with all those choices. I think the most important thing that I tell people ahead of time is that they need to have a plan. Because on the day when they say, hey, you're being discharged, you're like, oh, I don't know where I'm going. That really doesn't work.
Right. And at the time we're making this video, like now, typically in our area, about 90% of the people who have their hips replaced usually go home. The remaining 10% may need a little bit of extra time in a convalescent care center or a rehab place. And oftentimes, we've said this before when we were talking about total knee replacement, you can get an idea of how you're going to do after by an assessment before surgery. So when you go to your pre-op visit, they will work with you and determine the likelihood of you being able to go home or the possibility that you may have to go to a rehab center or somewhere for a short period of time, 1 or 2 weeks after your hip replacement, before you can go home.
Yeah, they're good at identifying people who are maybe at slightly higher risk of not being totally independent. So when they're going home, do you have to take an ambulance, or how do you get home? Can you drive home?
Yeah, that's a good question. I mean, when you're probably not going to be driving yourself home after. You've just had major surgery, you've had your hip replaced, you're not very comfortable, you're probably on some high dose of painkillers still, so it wouldn't be safe for you to drive home. So you need to arrange for a ride home. That's the first thing. A ride home or a ride to the rehab place that you're going. Sometimes you are taken by ambulance, though, to the rehab places, if you don't have anyone around that can help you.
Okay. Once you get home, are you going to be getting around?
Yeah, I think the whole goal of the physiotherapy that you get in the hospital right after your hip replacement is to get you mobile enough to get home. So you will be mobile. After your hip replacement, you're going to be able to get around, you're going to be walking, and you're probably going to be able to go up and down stairs.
Certainly one of the criteria at our hospital, you have to do some stairs before you leave. And that's with a walker or a cane or a crutch.
Yeah. So, Brad, do I need a hospital bed at home after my hip replacement?
I get this question all the time. So obviously if you really want to go out and pay a lot of money to bring a hospital bed into your house because the feeling of the hospital was such a positive one for you, you can do that. But I tell people that it's not necessary. I think having a place to sleep on the main floor is a great option if it's possible. But if you do have a second floor master bedroom, what I tell people is you'll probably come down in the morning and you'll go back up at night. You're not going to be going up and down the stairs all the time at the beginning. The one thing I tell people is maybe get rid of the waterbed.
People still have waterbeds?
I think so. Not very many.
Okay, so you probably won't need a hospital bed at home. You'll be fine in whatever you have. But like Brad said, you're not going to be going up and down the stairs 10 times in a day.
Pain. Are they going to have pain, Paul?
Yeah, this is variable, actually. I mean, with a total knee replacement, I guarantee you're going to have pain.
So much pain.
But with a hip replacement, there is some discomfort. Usually people say, well, I have pain, but it feels different than the pain I had with my arthritis. And usually it's not very severe. Now, occasionally there are people who still have a lot of discomfort in the first few weeks after a hip replacement. However, there are strong medications that we prescribe that can help with that.
I totally agree. Usually I tell my patients that you're going to wake up feeling significantly different, and usually people that have hip replacements wake up saying, wow, I feel so good. But I agree, if the operation maybe is a little more complicated, or people that have been on a lot of medication before surgery, they seem to struggle a little bit more with pain afterwards. So yeah, we'll give you lots of medication to take take care of that so that you can manage at home. At least kind of physiotherapy. What's your protocol for physiotherapy for the hips, Paul? Very different than the knees, obviously.
Very different. The knees, it's all about physiotherapy. For hip replacement, it's not as crucial to engage in physiotherapy after. The one thing, because of the approach that I use, the surgical approach I use, which is lifting off some of the abductor muscles, so the muscles that enable you to lift your leg out to the side.
The lateral approach.
Yeah, the lateral approach. So for that, for 6 weeks, I tell people not to actively abduct their leg, which means not to actively lift your leg out to the side. Other than that, physiotherapy is really mostly some gait training to show you how to walk again, and a bit of strengthening. But it's not as crucial, for example, as after a total knee replacement.
I would agree. So often for hips, people come into, a physiotherapist could come into the house for the first little while, and then at 6 weeks, that's when I change. Similar to you, I do the same approach. At 6 weeks, we let people strengthen those muscles that we cut through, so it's giving them some time to heal back together.
Right. Now, unlike physio, what is really, really important after a hip replacement, when you go home especially, is what we call total hip precautions.
Yes.
Those are precautions that you have to take for 3 months after your hip replacement to minimize the chance of dislocation, because an artificial hip can dislocate. So for 3 months, you're going to be given a list of precautions, things that you should not do. And these are mostly things like sitting in a low chair, or bending your knee up too high,
crossing your legs, that kind of stuff. Yeah, very, very different than a knee. A knee can't really, well, I mean, it can, but it can't really dislocate. But a hip, if you get into those extreme positions, it levers itself out of the ball and socket.
Right.
Okay. What about sleeping, Paul? Do you tell people specific things about sleeping with a hip?
I do.
Okay.
I do love to sleep.
Yes.
With a hip, you can sleep.
Yes.
So the main questions are: can I sleep on my side? Can I sleep on my stomach? I personally tell people, by the time they go home, they can sleep on either side. I'm not a big fan of sleeping on your stomach with a hip replacement, because when you're turning one way or another, you might break those total hip precautions.
Yeah.
But certainly on your back or on either side, and usually it's a good idea to keep a pillow between your legs for the first while, because then it'll keep your hips in a safer position.
I agree. Often at the beginning, people won't want to sleep on the operative side just because it hurts, but I agree. They say, well, when can I sleep on that side? I say just be careful, keep a pillow between your legs, move slowly, that kind of stuff for the hip precautions. How long do you keep the hip precautions?
3 months.
Yeah, a little controversial. I think some people have tried to bring it less because some people think it's not necessary, but for me, and I think I could speak for you too, the risk of dislocation is highest at the beginning, and the consequences are so great. So for 6 extra weeks, you can't cross your legs, big deal.
Right.
Or have a raised toilet seat, or have a cushion that you bring with you for those chairs. You might as well go to 3 months.
Right. Okay, so we've talked about leaving the hospital, where you're going to go, how you're going to get to where you're going, what you're going to need at home, hospital bed, probably not, stairs.
What do you tell them about I guess 2 things, one about the wound and one about the swelling in the leg?
Yes. There will be swelling in the leg,
yes,
for sure. You'll have swelling around the incision and down the leg. That's just part of the healing process. Now, the things you have to watch out for, though, is blood clot, because a DVT, a deep vein thrombosis, can happen. It's a risk of hip replacement.
Yep.
So that would be characterized by a lot of swelling and pain, sort of in the calf or the back of the leg.
Yeah.
If that happens, go see your doctor. Probably going to get an ultrasound to rule out a deep vein thrombosis or DVT.
Thankfully, the risk of that is quite low, and routinely we put people on blood thinners after surgery to help reduce that risk.
Yeah. And just mobilizing helps reduce that risk too.
Yeah.
And then the other thing to watch out for is the wound. You want to make sure that it's healing well without any infection. So how do you tell people to?
I tell people that they should keep it covered, at least until they see me, to have the staples out, usually at 2 weeks. As long as it's clean and dry and not actively draining. A draining wound is certainly concerning. It doesn't mean that you're infected. Sometimes you can have bleeding below the skin that comes out through the wound. So just keep an eye on that. And obviously, if the amount that's coming out of your wound is going up, then you probably should phone your surgeon and probably be seen sooner rather than later. But as long as you keep it clean and dry, I let people shower relatively early, keep it covered, dry it off, and then come see your surgeon, typically at a couple of weeks to have the staples out.
Yeah, and it's a bit tricky because, the signs of infection is skin that's red, hot, and swollen. But guess what? After surgery,
Red hot and swollen.
It's red hot and swollen.
Yeah.
So one thing I tell people is to see how you're doing from day to day. Are you getting better or worse? Generally, after surgery, every day you should be getting a little bit better. If you have an infection, every day you're probably going to get a little bit worse.
Yeah, and if the redness is spreading, or the drainage is increasing, or if you get a fever, those are potential signs of an infection, and then you just need to be assessed.
Yeah, if you're worried, get your doc to check it out.
Last couple things. When can I drive? When can I travel? When can I play golf?
You got a busy life.
I do. I can't get my hip replaced.
Well, that's a good question. Driving, the rule of thumb is 6 weeks.
Me too. Regardless of the leg.
Yeah, and I drive automatic, I drive standard, whatever. Just 6 weeks, pretty well. And because your reaction time to be able to move your legs has to be quick, and often within the first 6 weeks you're still taking narcotics.
And I tell people, physically you probably could drive if you had to get away from a burning building, but if you had to stop for a small child, or if you got in an accident, would a jury of your peers say, you know what, his hip replacement may or may not have been the cause of the accident? You just don't want to expose yourself to that risk.
Agree.
Traveling?
Generally, short car rides, like driving for an hour, something like that, you can do within a few weeks. But traveling by a plane, probably 3 months is what I tell people.
I tell people that too, and one lady got on a plane at 6 weeks, and because of the low seats of the plane, she dislocated her hip on the tarmac.
Really?
Yeah, and she had to be transferred off, and then ultimately had surgery. Yeah. So just got to be careful.
Yeah. So 3 months is a safe time. So when you're planning your hip replacement, just plan for your trips to be at least 3 months after.
Golf?
Right now?
Yeah.
Oh, let's go.
It looks nice outside.
Yeah. So golf, again, 3 months.
Me too. Because the twisting motion, I think, is a little different. Sometimes I let my knees go to the range at 6 or 8 weeks, but I agree 3 months.
Yeah, I'll let the knees go back earlier, but 3 months.
Tom Watson almost won the British Open 9 months after having his hip replaced.
Really?
Yeah, within one shot.
Yeah. 3 months.
And then lastly, back to work.
Oh yeah, going back to work. That's a variable one.
Yes. What's the soonest?
Yeah, the soonest I've seen people start working as soon as they get home.
Me too.
They work from home. I don't know how good their work is because they're probably still on some narcotics, but they can start working from home right away.
I had a farmer in a barn at 2 weeks.
Really?
Yeah. He was like 80.
Okay, so yeah, I mean, it's very variable. I find people who are self-employed generally have to get back to work quicker because they don't have any income to cover them. But if you have some sort of benefits plan, then you can afford to take 3 months.
Yeah.
So generally, I would use that 3 month rule again.
I would agree.
For most jobs, stuff where you can work at home or desk job, probably sooner. Very physical or labor intensive jobs, it might even be 6 months.
Yeah, and I agree with that. And it's usually the young people that want to go back, and I tell them, listen, I know you want to get back to work, but I want you to have a good hip for the next 15 or 20 or 25 years. So if we can get an extra month out of you and not put you at risk in a slippery position or on a ladder or something crazy, the last thing you want to do is cause a problem that's irreversible. So yeah, I agree with that philosophy.
Okay, so
if you have any further questions about total hip replacement after surgery or anything else related, please send your questions to talkingwithdocs@gmail.com.
And remember, you are in charge of your own health.
See you next time.